But first of all, good afternoon, and thank you everyone for joining us for our Lunch and Learn. So for those of you who aren't aware, September is National Preparedness Month, and we thought it would be a really good opportunity to share some of the work that is being done within the department that goes on behind the scenes or that you might not be aware of. And so my name is Andrea Skews. I'm with the Office of Preparedness and Response. And today we have our presenters are Susan Collier with the Office of Administrative Services, and we also have Adam Smith, who is my colleague in the Office of Preparedness Response. We did set aside time to at the end to answer any questions that you may have, but there's also the Q&A box. So feel free, if you have a question, to use that Q&A box. Otherwise, I will turn it over to Susan to start the presentation.
Thank you so much, Andrea. Hi, my name is Susan Collier. I'm with the Office of Administrative Services, Emergency Management. I just wanted to talk briefly about what we do here in our office. And just for those of you who have a second screen, I'm going to go ahead and drop the link to the slides in the chat. So if you'd like, you can follow along. Give me a second here. Okay. Can you guys see the slides? Yeah, okay. All right. The Office of Administrative Services does various things, and to explain those, I'd like to first start with the 5 mission areas of emergency management. Those are preparedness, response, recovery, and mitigation / prevention. Wow, that was quick. First, we have preparedness. The Office of Administrative Services offers training to employees. This training includes Stop the Bleed. We offer 2 different types of courses for that. It is a 1-hour-long course, and we have both an online or an in-person. We also offer the American Heart Association Heart Saver First Aid CPR AED course. This is a hybrid course, which means you get both online and in person. So we have 3 hours of online and 2.5 hours in person. And at the end, you get a certificate, which is good for 2 years. Next, we have the FEMA course IS 907 Active Shooter. This is an online course. In addition to this, we also have the option to do an in-person course where we work with the county sheriff in your area to put that course on in your building. And that is also a 1-hour course. Next, we have the Community Emergency Response Teams training. This course is 16 hours of online and 16 hours of in-person training, hands-on. In addition to that, we offer additional FEMA training for those who are members of the Community Emergency Response Teams. The goal of the BEST program is to be able to build a team in each building that is able to respond to an emergency or disaster and be able to help employees and stabilize the incident and protect property. In addition to this, if you are interested in this training, there is a link here for those of you who are on the slides for an interest form. I will, at the end of this, after the end of my presentation, I'll also put the link to the interest form in the chat. Right. Next, we have response. For response, the Office of Administrative Services is updating all of the building's evacuation plans. This includes making sure that every building has floor monitors and evacuation assembly area signs, if they don't already have them. In addition to holding a yearly fire drill or evacuation drill if they are not already being done. This also includes radio training. In addition to that, if there was a response, we would also activate our BEST CERT teams, which is the Building Emergency Support Teams, Building Emergency Support Training, and the CERT team. So you can see the image here. This is the first group that was taught in the MESOB. These people are trained to be able to set up a command post, set up a medical treatment area, to perform search and rescue transport, triage, and fire suppression. They have the equipment and the materials so that they'll be able to provide first responder efforts until the police or the fire, whatever the case may be, arrive. Next, we have the activation of the building inspectors. So there's also a course in the BEST program called ATC 20. This course is specifically for people, the individuals who are the facility coordinators. This training helps them so that they'll be able to be the official building inspector after an earthquake. So if there was an earthquake tomorrow, what you would see these individuals don their equipment, they would inspect the facility, they would tape off areas that are unsafe, and they would complete written reports for both FEMA and the county. They would also be posting placards such as those as you see here. Once these placards are on the door, they indicate whether or not you can re-enter the building. This is very important because Department of Health and Human Services has people who are in state custody, such as those who are in the foster care system or the juvenile justice system. And we want to make sure that those people who are in state custody can go back into the facilities immediately following an earthquake if it is safe to do so. Next, we have response and recovery. For response and recovery, the Office of Administrative Services is over the continuity of operations plans. For those of you who don't know, a continuity of operation plan lists out the items of day-to-day tasks in your office or your division that must be brought back up in a timely manner to be able to make your office function properly. For example, if there is something that you have as a day-to-day task that absolutely must continue, those items would be listed out in your continuity of operations plan in a checklist form, so that way that these items can be brought back. The chart here shows the different priority levels, such as 12 hours, 24 hours, 72 hours, and 7 days, or non-essential. Moving on. Next, we have mitigation and prevention. For mitigation and prevention, the Office of Administrative Services facilitates a program called QuakeSmart. This program does building assessments to find areas that need to be secured to be ready for an earthquake, such as the items here. Next, we have testing, training, and evaluation. For all of the items that we have here, we will be training, testing, and evaluating them using the FEMA program and exercise cycle. We will be conducting all of the training that is necessary to make sure that all of the things discussed that previously will be working properly in the event of an actual emergency or disaster. What can you do as an employee? First, make a plan. We recommend that you go to ready.gov and learn how to make a plan to keep your family safe. Next, make a kit. FEMA has very clearly laid out information for families and for children to help them be ready for any event, for all hazards. So if you haven't been to this website before, I highly recommend you go sometime today, ready.gov. Next, I'm just briefly going to talk about the differences between the Office of Administrative Services and the Office of Preparedness and Response. The basic gist is that the Office of Administrative Services is internal, the Office of Administrative Service is internal, and the Office of Preparedness and Response is external, and I just realized that those have been switched. So if there's any questions, we'll be taking that at the end of this lunch and learn. Thank you.
Thanks, Susan. And we're going to shift over to my slides, which, one second. So Adam and I are going to be talking more on the Emergency Operations Plan, or EOP, through the Office of Preparedness and Response. And so Susan did share a little bit about our office, but we really focus on that overall disaster preparedness and response efforts for our department, so more externally facing. And our goal by the end of this is that you understand what are some of those roles and responsibilities of the department in emergencies, know about the emergency operations plan and maybe where to find it, reiterate kind of what might be expected of you in an emergency, and then also know where to find some resources on our intranet site. So like Susan mentioned, there's two distinct planning efforts. So we have the internal day-to-day operations, getting that back online in the event of a disaster. And then we have the incident response, which is more outwardly focused and supporting our partners. Both require employee and building safety. So they're parallel planning efforts. Our department is the lead agency for two major emergency support functions. And the first one is mass care and human services, and the second one is public health and medical. And this isn't going to be on a test or anything, but just so you know what ESFs are, they're coordinating structures that group resources and capabilities into functional areas. And so our department, being the largest one in the state, has two really critical emergency support functions that are under our authority. Really briefly, mass care human services, which is what Susan's office oversees. It's really the sheltering, feeding, caring for people affected by the disaster, including those who might be displaced or in need of being reunited with missing family members. Here in Utah, mass care and human services is co-led with Susan's office as well as American Red Cross and other support agencies. And then when we shift over to public health and medical, we see that the scope is pretty large. Pretty much anything that concerns the health and well-being of the population and the systems that serve them falls under that ESF8 public health and medical scope. And it just varies. You can see more of the healthcare operations, but then you can see more of the traditional public health operations. And it just varies on the disaster or emergency that occurs. So when we talk about incident response, we really just want to focus that all disasters start and end locally. Our job is really to help support local response if they're overwhelmed. We coordinate with local, state, and federal partners to ensure accurate information is shared, provide guidance, and ensure that critical resources are shared as well. And then if we're overwhelmed, we then request federal support. So the bottom line is our department role in an incident response is to support, coordinate, and communicate with our local jurisdictions as well as federal if overwhelmed. And with that, I will turn it over to Adam to talk more about the emergency operations plan.
All right, thanks, Andrea. So jumping right in, the purpose of the emergency operations plan is to provide that response framework for DHS employees, as well as the Utah population that is under state authority. For example, anyone housed in state buildings like correctional facilities or state hospitals, or as Susan mentioned, foster care facilities. The EOP focuses on all hazards planning through DHHS's version of the incident command system, the ICS structure, and we'll touch more on that in a few slides. The EOP is used to guide DHHS's immediate actions and operations required to respond to any incident. Next slide. So the EOP acts as an umbrella or a base plan for both functional and hazard-specific plans for the department. So examples, mass fatality, medical and workforce surge, catastrophic earthquake plan, or the catastrophic earthquake plan, infectious disease, and so on. So the EOP is always activated first, and then other plans as the incident requires. So all of these supporting plans, as well as the EOP, are rooted in those ICS principles. So that incident command system that I mentioned before, and the purpose of that is to essentially provide response staff as well as partners accurate information, accountability, better planning, and also a quick and efficient finance logistical support for all of those incidents. And then one important note specific to DHHS is that response staff will be organized by function, not operational unit. So moving on to the ICS chart, this snapshot of the department's ICS structure. At our department, the executive director or executive leadership team is responsible for assigning an incident manager for each incident. So the incident manager, much like an incident commander, is the leader of the response. They set the goals and objectives and also make those tough decisions that are at times required during an emergency. The incident manager can also adjust this ICS organization and the scale it's needed based on the incident. So the command staff you can see is shaded in purple. You have your PIO officers, your public information officers. They deal with the public and the media. They develop materials to be shared, and they coordinate, those briefings that often take place with both the media and the public. Your medical officer, advises the incident manager and response staff on those health and medical aspects. Different items for the command staff, your safety officers, legal team, different liaisons for partners, liaisons for tribal partners, local health departments, different teams, like Susan mentioned, the CERT team, the BEST team as well. And then your general staff, highlighted in green, you have your operations section. They're kind of seen as the doers, your logistics, the providers, finance, the payers, the planning section, thinkers. And then just to reiterate, specific roles can't expand or contract. It's all up to the incident manager's discretion on what's needed for the incident. And then moving on, just for this presentation, we don't need to visit in depth every section. We just wanted to go into a bit of detail for the operations section. Those are the doers. As Andrew noted earlier, DHHS is the lead agency for ESF 6, mass care, which Susan's office is ahead of that. And then ESF 8, the health and medical, us at OPR, those health and medical response operations. And these functions are what our response as a department is based on. So of course, these will vary by incident, but some of these operations sections and even branches, as they're sometimes called, they can include biosurveillance, medical countermeasures, resource distribution, fatality management, and so on. So then moving on to what triggers our departments need to activate the EOP in this corresponding ICS structure. So on the common sense side, emergency declarations, if the governor declares a state of emergency, or at a smaller level, a county or a tribe, requests for help or makes an emergency declaration, then the EOP will be activated. On the federal side, public health emergencies that can impact Utah, presidential declarations. But baseline, any incident or potential incident as well that could have a public health or medical impact to the state would be a reason to activate. And then just to sum up and review, again, EOP activation after an incident occurs, DHHS leadership and EDO will assess the situation and determine the impact and level of our department that's needed. DHHS employees will be notified, hopefully through UNIS, and we'll touch on that here in a minute, or other communication methods. Our department's operations center will be activated either in person at the Cannon or Mesa building or virtually. EDO and DHHS leadership will designate an incident manager, as we touched on, and that incident manager again will assign that ICS structure. Response staff will, with the oversight of the incident manager, will establish those incident priorities and objectives. And then those initial communications will take place often through PIOs and liaisons. We'll begin to notify key partners who may have a role in responding to the incident as well. And then lastly, we'll activate other emergency plans, those functional and hazard specific that we mentioned earlier. With that, I'll turn it back to Andrew.
So I think one of the big questions that we want everyone to know is how will staff know what's going on? And so this is our plug for the Utah Notification and Information System. It is the department's official emergency notification system. So UNIS allows leadership to share critical emergency information and instructions with employees regardless of location. You could be working from home, you could be commuting, you could be in the office. So it's a way to blast employees through email, phone, text. Users usually will receive messages in the event of emergency, or we do periodic testing. So we actually did a drill about 2 weeks ago. So hopefully you got that message. If you did not, it might be time to annually review your information and update it. You can also use UNIS to enroll into the mandatory air action day notifications. That is an optional or an additional thing, but you have to opt in to enroll. And then it's just recommended that you provide several methods to ensure that timely message is received. If you only have your work email and your work phone number, but you're not at work and you can't access it, it might be good to add your personal phone number and change the settings. So for instance, my preference is to get a text message to my personal cell and my work cell, and then an email and then a call. So I have my preferences set up in a way where I know the best mode of communication for myself. And if you're not sure how to update your information, I will share the link of the UNIS instructions in the chat after I'm done. But that's just our plug for UNIS. Next, what is expected of you? If there was a large incident, you know, why are you here? What is expected of you? I think Susan already mentioned this, but be personally prepared. Make sure you know what you're going to do at home with your family. Have a kit. Make sure you're able to take care of yourself, because you have to take care of yourself before you could come and support the department. Be registered in UNIS. Again, it's a very important tool. Be familiar with our emergency plans and just plans in general. Know you might have a role in the response. You could be doing your day-to-day job and more of that continuity of operations work, depending on your individual OU's COOP plan, or you might get pulled into support response operations. It really just will depend on the scope and scale of the response. And then again, another plug to get involved. Susan shared the link to the interest form for the Building Emergency Support Training Program, but that's one great way to get involved. And there's also we're relaunching the DHHS Emergency Response Team. And this is really a focus on response operations to fill roles within the incident command structure if we were activated. And so there is a slide on the Team DHHS intranet site, a link on the Team DHHS intranet site about emergency preparedness. It has resources, as well as this is where plans will be posted as they get updated. I'll share the link again in the emergency or in the chat after I'm done. But there is a website that you can access that has a lot of good information that we post as we get them updated. And then if you're really ready to dive into preparedness and you haven't done so already, there's the FEMA independent study courses, which are self-paced and online. There's no cost associated with taking them. And we recommend, if you are going to start, the independent study 100 and 700 are probably a good starting off point for that response operations. I know Susan also included a couple other really key ones with active shooter. So those are some additional resources we have. And then just to wrap up our presentation, here's our contact information for all three of us. If you do have additional questions, feel free to reach out. And with that, we will turn it over to questions if anybody has any.
Do employees have the ability to come off of mute?
I don't think so with a webinar.
Okay, then let's put the questions in the chat. And while you guys are doing that, I would like to just really quickly go over the items that are in the Community Emergency Response Teams training while you guys are writing your questions. There are 8 different units in the Community Emergency Response Teams training. These include disaster preparedness, CERT organization, disaster medical operations 1, disaster medical operations 2, disaster psychology, fire safety and utility controls, light search and rescue, and certain terrorism. If you haven't already taken this class, every single city in the state of Utah offers this class as well. The main difference is that at the Department of Health and Human Services, this class is free. A majority of the classes in the state of Utah, if you were to take a class, a community emergency response teams training through the city, they will actually charge you money to take the course. So yeah, is there any questions in the chat?
It looks like there's a couple. The first one is, would all of these trainings be done in personal time or work time? Susan, do you want to start first with your side of the house?
All the trainings that are involved in the BEST program, which is the Community Emergency Response Teams training, the first aid, CPR, AED, active shooter, and stop the bleed. All of these courses can be done during work hours. With a little caveat, the executive director's office has specifically said that for the first aid CPR AED course and the community emergency response teams course, a supervisor approval is required. So what will happen is once you fill out that interest form, which is in the chat, you and your supervisor will receive an email asking your supervisor if it's okay that you attend this course. And as long as they reply with approved, you will be enrolled into the next available course or a course that works for your schedule. In addition to that, the executive director's office has also specifically said they wanted to make the first aid CPR AED course available to anyone in the Department of Health and Human Services for free, because they feel it's so important. Those skills are so important for every single employee to have.
And I would say on our end with some of those other trainings, if you join the emergency response team, you do need to get supervisor approval. And those additional trainings would be done as, you know, your schedule allows. So it could count on work time. And then I think that question's been answered. There was a comment about when we did the drill a couple weeks ago, several people thought it was a phishing email. As the email address did not match. We learned that we have that as a lesson learned for our office as we do another drill in April. We just hope that as we get more familiar with the system, people will recognize that it's not a phishing email. I feel like Ashley is putting me on spot. Do you have an emergency kit at home, Andrea? I will say I don't have a good one. I need to probably update mine. But again, thanks for putting me on the spot, Ashley. I know you asked that on purpose. Jared asked, is there a CERT at Cannon specifically? I think that's for you, Susan.
Yes, the Cannon building actually already has a community emergency response team, as well as the MESOB, and I think 4 or 5 other specific buildings, including the Ogden Regional, Academy Square, the Utah Developmental Center, and there are people also in the Utah State Hospital that are trained as well. So the goal here is to have a CERT team, which consists of 9 people who are trained to open and operate a community emergency response team command post, and to be able to do all the functions within the command post. So a lot of buildings have them, and currently we're scheduling the community emergency response teams by region, just because we don't have enough. In order for us to hold a class, we need to have at least 15 people. So if you had 15 people in your building that would like to be trained, then yes, we can hold a class in your building.
Thank you. The next question is, if we take these courses, what is our obligation to the department in the event of emergency? I think that really will just depend on, again, the scope and scale. For those of us that were part of the Department of Health before the merger, we had over, I think, 900 staff involved at any given point with the COVID pandemic response. And so I think it really just depends, again, on scope and scale. And also whether your department is one of those essential functions where you have to maintain kind of those day-to-day operations, or if you can maybe drop some of your workload and support the response operations. But as it unfolds, we would put out those requests for staff support if needed. So I think
to talk about for the BEST program, as far as the requirements of actually acting, the community emergency response teams 16-hour training is good forever. You can take the online course as many times as you'd like until you're comfortable with the material. And then the online, the 3 hours of the first aid CPR AED course, that is a personal link that you receive. And once you activate that link, it's good for 1 full year. So you can retake it as many times as you want for 1 full year, just to make sure that you're comfortable with the material. As far as responsibility to act, that is completely up to you. There is no mandatory requirements for you to act. However, having those skills and the ability and the knowledge to be able to help people is an amazing thing to have. And a majority of people, if given the opportunity to help save or help other people will do so.
All right. The next question I think is for you. Where can we read the continuity of operations plan to know how our program is included?
Coming soon, every operational unit will have their own continuity of operations plan. This does not currently exist. There are some continuity of operations plans that have been created in the past, but they will need to be updated. The Department of Health and Human Services has an overarching continuity of operations plan. However, the information in that plan contains names and phone numbers and personally identifiable information that cannot be given to the public. You'll need to request from your supervisor to get a copy of the continuity of operations plan. However, I can tell you that individual offices, the overarching plan is specific to the leadership and the overarching leadership of the Department of Health and Human Services, and not individual offices or departments. That is why they would like in the future, every operational unit to have their own continuity of operations plan that lists out the day-to-day tasks within their area, so that we can have those tasks written out on a checklist form so that they can be printed out in advance, put into a clipboard or binder. And in the event of an actual emergency or disaster, they can be easily gone down every single item on those day-to-day tasks to make sure that they come back up in a timely manner.
All right. And I think this one's also for you, Susan. How do I find out where the emergency plan is for my building, and do they ever do drills?
Oh, I have to know can you please put what building you're in? I'm so curious.
I would say it's probably Maysab or Cannon. Is this my guess?
Okay, so the Maysab has had one evacuation in the year, which is required. However, especially with everybody coming back into the office and the different schedules, Monday, Tuesday, Wednesday, Thursday, and so on, you may not have been there that day when the evacuation took place at the Maysab. Eventually, we're going to have all the evacuation plans gathered together, and we're going to update every single one of them to make sure that they follow the same format, and that those evacuation drills are taking place on both the Monday, Tuesday, and the Wednesday, Thursday groups, depending on how your building has it set up. For example, there are juvenile justice centers that actually have people there 24/7. And as a result, when they do evacuation drills, they'll do an evacuation drill for every group of people within that 24-hour period, so that it's tested thoroughly.
Okay. I know, so this is just yay. So there were 3 individuals that completed the CERT training 2 weeks ago. So we'll answer that. And then one more question. Where can we find the online CERT training to rewatch? I was trained in 2019, but I didn't know how I could keep access to all the training.
Yes, I will go ahead and before we close out here, I'll put the link so that that online training is 16 hours. If you are going to be doing this training during work hours, you really need to fill out the interest form and take the course from me. However, there is an online training that is available for free. Anyone can take it 24/7, and I can put that information in the chat. So, and like I said, if you've taken CERT in the past, this is a great refresher. With the caveat, I'm going to put the link in the chat, but don't do this course during work hours unless you've received permission from your supervisor and we've worked that situation out through the interest form, please.
Okay. I think we've answered all the questions. The last one is what's for lunch. So I think we have made it through our lunch and learn. Hopefully this isn't the first and only lunch and learn we do on some of the emergency preparedness response work that the department does. Our goal is to continually engage you all. This is our day-to-day work and not necessarily something you always think about, but we're always thinking about it. So we're the doom and gloom group, right? So thank you so much for joining, everyone. We hope you found this lunch and learn informative and helpful, and we will try to do another one in the near future. So thank you so much.